Welcome to the Oral Health Education Series, Module 4, Fluoride, Part 1. My name is Dr. Brecky, and these modules were created in part with Ready, Set, Smile. Module 4 is an overview of one of the most useful tools in the field of oral health, which creates a major impact on both individual and population health. This project is subject to copyright by Ready, Set, Smile and Dr. Brecky. For an introduction to fluoride, in part 1 of this lecture series, we will review the discovery of fluoride, the science behind fluoride, the fluoridation of public water supplies, and also the fluoride debate. We will also get into risks of excess fluoride, which can happen. In the second component of this module, part 2, we'll review topical fluorides at home and in the office, as well as the effect of systemic fluorides, which are ingested through the public water supplies. We'll also review silver diamine fluoride, and we'll go over resources for education, tools to help you educate others. So fluoride is the first-line preventive agent used to fight tooth decay and dental caries. Why? Well, what exactly is it? It's a colorless, odorless element, and its intricate crystalline structure makes tooth structure even stronger than what it was originally. How does that happen? Well, we'll go into detail. Fluoride was discovered as a bit of a puzzle piece. In 1909, Dr. McKay opened up a practice in Colorado Springs where he recorded brown staining on the teeth of 90% of his patients who grew up in Colorado Springs. Interestingly, he noticed that this problem newly affected children only, and it lasted their entire lifetimes. It posed no risk to adults who didn't already have this problem or stained brown teeth. Another thing that he noticed was these brown teeth were actually impervious to dental caries or decay. They couldn't get it. So interestingly, later, this darkening of tooth structure was termed something called fluorosis. So fluoride, the solution. Pun intended here. While fluorosis is actually quite unappealing to the eye, it's been determined to be not a danger to children or adult health. It's essentially just an aesthetic or problem with looks. In 1931, it was discovered that fluorides were actually naturally occurring in water supplies, but not all water supplies. And in some water supplies, like Colorado Springs, maybe a little bit too much. After the NIH researched this occurrence for nearly a decade, it was determined that fluorosis didn't occur in water supplies that had 1 part per million or less of fluoride. It was learned that smaller amounts of fluoride made teeth less prone to decay, but they didn't actually cause that brown discoloration. So, more about this discovery. Fluoride is an inorganic, simple fluorine anion for all of you chemists out there. It is a natural component of both salt and freshwater sources throughout the world. So scientists developed a hypothesis. Would adding little bits of fluoride to water supplies that didn't already have it help to prevent tooth decay? Well, what about things like toothpaste? Thus, with its decay-fighting abilities, fluoride was added to toothpaste, it was added to mouth rinses, and it was added to community water supplies. So let's just take a step back and talk about some chemistry. You've heard the term demineralization, which means breakdown of hard tissue surfaces. That means weakening of the tooth structure. Like we've discussed in the previous lectures, every single time we eat, our mouths become acidic or vinegary or pickly, and that causes the tooth structure to weaken and break down. This is a normal process called demineralization. Remineralization is the deposition of minerals into areas which have been damaged or weakened or demineralized. How does this happen? Well, that's where fluoride comes in. Hydroxyapatite is the normal crystalline structure within enamel. That's what makes your teeth strong. like we discussed, that's the strongest thing in your entire body, is the outer surface of the teeth, the enamel. Fluorapatite is actually a stronger, less soluble crystalline structure of hard tissues. It's created when fluoride is added to the tooth structure, something that happens over time. So, what exactly happens to the tooth when the enamel demineralizes? Like we discussed, it weakens. Erosion or acid attack can occur. Caries also is a possibility. This can lead to sensitivity, pain, loss of tooth structure, even fractures of the tooth, which down the road could lead to loss of the tooth. So, talking about this environment, enamel is the hardest substance in our entire body. And you can see over here on the right, the enamel is the outer surface of the crown of the tooth. Now, effects of fluoride uptake are both topical, they happen locally in the oral environment, and systemic. They can go through the whole body before they actually come back and affect the teeth. This is why it's so important for children to have sufficient fluoride intake when they're very young. Because what's happening? Under the surface, their adult teeth are developing, and it's essential that they get that fluoride taken up through their diets and water. Now, root structures of teeth underneath the gum tissue, they don't quite have what's called enamel, but they do have something called cementum. Now, cementum is less strong already than enamel. So as our gums recede and the root structure is exposed, it's even more susceptible to that demineralization, wear, and breakdown because it's already weaker. So, since those root structures are not as strong as enamel, it's even more important that in instances of gum recession, it's even more important to make sure that one has adequate fluoride use topically and systemically. So, like I says below, fluoride exposure is even more important for those with recession or receding gums, which typically happens to older adults. So let's take a step back. Fluoride, how does it work? 1, it promotes remineralization. It actually permeates the tooth structure and makes it stronger. Secondly, it inhibits or prevents demineralization from further happening. It makes your oral environment stronger, which can prevent the breakdown of those teeth via acids. And third, it actually directly disrupts the bacterial processes. It can actually inhibit or prevent bacteria from thriving. So it's actually very, very effective, and that's why it's recommended. So a history of water fluoridation, which hasn't come as the most easy task for cities across the United States and throughout the world. In 1945, Grand Rapids, Michigan was actually the first city in the world to fluoridate its water supplies. So, for 15 years, researchers actually studied the tooth decay among this population. 30,000 children in this city were studied, and it actually showed that the caries rate of children born in the cities after the fluoridation of their water supply dropped 60% compared to children born prior. This was a huge, huge, huge difference. At the time, they may have received scrutiny. However, according to the CDC, community water fluoridation has been one of the top 10 public health achievements of the 21st century. What exactly is community water fluoridation? According to the ADA, community water fluoridation is the controlled adjustment of the natural fluoride concentration in community water supplies to the concentration recommended for optimal dental health. So water fluoridation today, is this monitored? Is this regulated? Absolutely. The Safe Water Drinking Act, passed in 1974, requires the EPA to evaluate and ensure safe drinking water is available nationwide. Nearly 75% of U.S. water supplies now have fluoride. The number of Americans without access to fluoridated water is still about 100 million. people. Why? Well, if you think about it, some cities actually aren't supportive of the water fluoridation movement, which we'll get into in a moment. And secondly, a lot of people living in the United States live in rural areas that may not have access to a community water supply. Thus, for those with well water, it's very, very important to encourage people to check their well water to see how much fluoride they have, whether it's too little or too much. There is a sweet spot. Again, it's mentioned here that the CDC mentioned water fluoridation as one of the top 10 greatest public health achievements of the 20th century. The 2020 goal of the CDC is actually to increase fluoridated water to 80% of the population. You can actually visit the CDC site to learn about your water and your community to see how much fluoride might be in your water supplies. So fluoridated water, a key solution. Is there just one or are there multiple? There are many different compounds used to fluoridate water and they are regulated. There's sodium fluoride, there's fluorosilicic acid, there's sodium fluorosilicate. Say any of those 10 times fast. However, it is important to also note that not all countries in the world fluoridate their water supplies. For the countries that actually have community water supplies. Fluoridated salt is actually another common method for providing fluoride to people, and that's Costa Rica, France, Switzerland, Colombia. Those are just some examples. Here in the United States, we're used to iodized salt. Just remember, it's very important to note that older children and adults are not at risk for dental fluorosis, for having too much fluoride put into their teeth, because their teeth are already developed. There is still a risk for young children, and it's very important that they don't get too much fluoride while their permanent teeth are developing underneath the surface. Please follow the recommendations. The key is finding the balance between remineralization and demineralization. As you can see here, remineralization is supported by fluoride, by healthy habits, by brushing, flossing, drinking tap water. Demineralization, snacking frequently, eating sugars, eating acidic foods, sour candies, etc. The key truly is finding the balance and making sure that you are within the recommendations. So let's review the effects of fluoride. Topical versus systemic. Like we discussed, fluoride actually affects the teeth through two different pathways. So what are the topical effects? Topical means locally. Fluoride is taken up by the saliva, serving as a local reservoir for the agent to promote remineralization. As you brush your teeth and you get that fluoride toothpaste in your mouth, if any of those tooth structures are worn down, they can uptake that fluoride and become stronger. This occurs especially when the oral environment plummets below the critical pH. This is why it's recommended to brush your teeth before you have breakfast. Fluoride also inhibits bacterial synthesis of the specific bacteria that lead to tooth decay. So, topically, right in the mouth, it prevents those bacteria from thriving, which is very, very good for you and for your teeth. Just remember, the critical pH is reached every single time we eat or drink anything that isn't water. Topical effects. So what are some of these sources? We have toothpaste, mouthwash, tap water, professional applications at your dental office like varnish, and yes, foods, even your foods. So just a quick review of saliva. Saliva is the reservoir that allows those minerals to locally act on the teeth. As you can see, it not only contains, proteins, digestive enzymes, etc., but it does hold those minerals like fluoride, and having good saliva flow is a very, very beneficial thing for you and for your teeth. What are some systemic effects of fluoride? Well, first, fluoride is ingested and travels all the way through the GI system. It's then taken up in your body where it helps to make growing teeth stronger, especially for children. It is absorbed systemically through the whole body in children and adults, and it's actually released in small, small amounts within the saliva that we just talked about, offering a actual topical or local benefit even when one has not immediately used products such as toothpaste or mouth rinses. This constant flux of fluoride in the saliva is really beneficial, and that's what actually keeps our teeth so strong. Um, we as humans tend to eat and snack often, so, having this fluoride systemically in our bodies from a little bit of tap water actually is a huge, huge benefit to keeping our teeth strong and healthy. So, what are some of the sources of systemic fluoride? Well, we really don't recommend eating toothpaste, drinking mouthwash, or anything like that. It is not recommended, so make sure little ones are not swallowing toothpaste or mouthwash. But some of the sources where we are getting some systemic fluoride is our foods. Whether they're fresh or whether they're processed, those foods were created in an area which, yes, used water and oftentimes uses community water supply water. The same with processed foods. Check to see where a factory might be located to know what source of community water did that factory have. Is there fluoride in your food? Most likely, yes. Drinks as well. Anything other than, of course, water has typically used water to be created. Again, just knowing where it was located might provide you insight on how much fluoride might be in that certain product. And of course, tap water. And this is why we try to encourage people to drink tap water. Many, especially immigrants from other countries who come in and may not trust the local water supplies because they weren't able to trust the local water supplies from their home country. It's very important to teach them that our tap water is safe and beneficial to them so that they're not just consuming bottled water. So, too much of a good thing, can that happen? Well, of course, there is such thing as too much fluoride, and it typically results in something called dental fluorosis. Now, mild fluorosis can create just a chalky staining of teeth. It actually makes them appear white. However, moderate to severe fluorosis, like we discussed, leads to a brown staining of the teeth, which is aesthetically unappealing. Now, fluoride does not pose a risk to overall health of children unless it is consumed in drastic amounts. So is dental fluorosis the only thing that can happen from too much fluoride? No, there's actually something called skeletal fluorosis, but that would have to require so much consumption of fluoride. Please, it's just very important. Teach your children to not swallow their toothpaste or mouth rinse, and if they do happen to swallow too much than is recommended, follow the directions on your toothpaste or mouth rinse and contact poison control. And as you can see here, this is actually a picture of mild fluorosis. Just a chalky white staining. Does it look bad? No. But is it different than normal? Yes, it is a variation from what's normal, or what we consider normal. So just keep that in mind. This isn't negative for the teeth. In fact, it typically means that they are a little bit less prone to cavities. So too much of a good thing, infants. When we think of infants, these are typically the members of our population who are at risk of fluorosis or having too much fluoride. Now, their permanent teeth are developing underneath their baby teeth at a very, very young age. And they're what we call calcifying or hardening. That enamel is forming, and it certainly does require an adequate amount of fluoride, or would benefit from that, but we definitely don't want too much. Infants also have a very, very high risk of tooth decay, not only because baby teeth are more prone to tooth decay, however, their oral hygiene is poor, their eating habits are more frequent, and their caregivers typically make decisions about what, when, and how they eat. So it is still essential for infants and young children to receive recommended amounts of fluoride to help prevent tooth decay. But too much of a good thing? Possibly. Infant formula. Remember, baby formulas are often created as dehydrated powders, which require the addition of water, or the reconstitution of water, to make them a milky substance that your kiddo loves. However, depending on where these formulas were manufactured, they may already have very high levels of fluoride within the powder. Why? Well, these powders may have been made in a community with community water fluoridation, and as things are dehydrated, turned into a powder, they require addition of even more water to bring them back to baseline. As you can see, whether you have a background in chemistry or not, that would probably mean that they have twice as much fluoride as the manufacturers intended. Thus, if you speak to parents or caregivers who are reconstituting formulas with water, note that they may be exceeding maximum recommendations of fluoride if they use tap water. This is the one case where I will say bottled water may be a good thing here. Just be cognizant of the ingredients within baby formulas and where it was manufactured. Think about bottled water, or buy a formula that's already reconstituted with water, liquids, or buy ready-to-feed formulas. So lastly, the fluoride debate. Wait a minute, there's a debate? Haven't I just been recommending fluoride this entire time? Well, opponents of fluoride usually oppose the water fluoridation for the following reasons. Government-enforced regulation, violation of informed consent. That's why a lot of cities actually choose to not put fluoride into their waters, because not every single person in that community is saying, yes, I want that in my water supply. Adverse health effects. There have been studies listed associating fluoride with hypothyroidism, behavioral problems, cancers, immune problems, bone diseases, reproductive issues. In the past, fluoride was actually used as a treatment for hyperthyroidism. So just to keep a note, the science community now fully recommends fluoride for the prevention of tooth decay and caries. However, these association studies are still out there. Fluoride is, at this point, ubiquitous. So these studies are, definitely to be taken with a grain of salt. But just please do your own research. Third, the worry of adverse health effects on the environment. And fourth, skepticism surrounding the origination of fluoride additives. If you're concerned about fluoride, please educate yourself. Talk to your dental provider, talk to your dentist, talk to your physician, and do your own research. You can visit ilikemyteeth.org/fluoridation. So, fluoride has been consistently determined as safe and effective through scientific research. When in doubt, again, educate yourself and encourage others to educate themselves as well, especially if there is skepticism surrounding fluoride, because preventing your kids or your family from accessing fluoride can play a very, very large role on the dentition. Of the thousands of credible scientific studies on fluoridation, none has shown health problems associated with the consumption of optimally fluoridated water. And that's from the American Dental Association in 2018. Now, fluoride is not the only remineralization agent, if you are concerned. There's many other things that are used to remineralize teeth, and you can take a list here, but one of the notes on this list, xylitol, you may have heard in the news or at Whole Foods, or possibly even in your current toothpastes and mouth rinses today. Read your labels and just understand what products you are using. Fluoride is not the only remineralization agent out there, but it is one of the best. So here's some questions to ask. Does your family drink tap water? Do they have access to city or fluoridated community water supplies? Do they visit your dentist or dental provider regularly? And do they use fluoride-containing toothpastes or mouthwashes? Do they brush their teeth daily? Just think about these questions. Have they been educated about fluoride? sometimes the lack of education is what causes fear of certain things. So education is really key. And again, that's what you're here to help us with. So thank you to our sponsors. With any questions regarding this module, please contact BreckyHuddleston@gmail.com. And we will see you next time for Fluoride Part 2.